Okay, so I'm Lauren. I'm a third-year medical student at University of South Carolina, and I am currently doing the Master's of Science in Clinical Research program at MUSC in Charleston. So our project was on this patient with Unicentric Castlemans disease who had an eruption of multiple hemangiomas. So for the abstract, Castleman disease encompasses several lymphoproliferative disorders, and it's mainly divided into unicentric or multicentric, with each of them having their own subtypes respectively. Unicentric is mainly involving a single lymph node or a single region of lymph nodes, and multicentric is multiple. Multicentric has an association with systemic disease and is usually refractive to treatment. Sometimes they do try to use anti-IL-6 therapy, and UCD otherwise is treated surgically. So with Castleman disease, there's not commonly any associations with cutaneous manifestations. MCD has rarely been reported to occur with multiple eruptive cherry hemangiomas, but this has not been previously reported with UCD. So we had the opportunity to diagnose and treat a patient with multiple vascular proliferations and hemangiomas in the setting of unicentric Castleman disease. So UCD, like I stated, is not normally associated with systemic symptoms. Sometimes systemic symptoms can be seen, but that's only if there's compression of nearby structures. UCD is typically an incidental diagnosis and normally tests negative for HHV8, which distinguishes it from multicentric. And there are very few reports of vascular proliferations in MCD, like I said, and this is thought to result from increased cytokine levels like VEGF and IL-6. So through our literature review, we were unable to find any reports of hemangiomas in unicentric Castleman disease specifically. So we had a 60-year-old African-American male who presented for follow-up of palmoplantar psoriasis. Past medical history significant for sarcoidosis, psoriasis, and unicentric Castleman disease, abbreviated UCD. And he was diagnosed with UCD at the age of 57 because he presented with right neck lymphadenopathy. The core needle biopsy demonstrated reactive lymphoid tissue, and the PET scan demonstrated level 5 lymph node activity. So he had surgery for those lymph node removals. He was diagnosed with a hyaline vascular subtype of UCD and treated with 4 weekly infusions of rituximab, 375 milligrams. Since then, he's been following up with hematology oncology with yearly PET scans, but he has no evidence of disease progression. So on his current presentation, he's observed to have numerous discrete papules scattered on his trunk, extremities, and face. A biopsy was done of the right forearm to rule out cutaneous sarcoidosis, and pathology found the biopsy to be a benign hemangioma. So further review of history revealed multiple previous biopsies showing angiomatous lesions, including vascular proliferations and hemangiomas. So he followed up for 2 months later, and presented with multiple new lesions. So dermatology and hematology oncology have continued to follow him and monitor him. If any of the lesions are bothersome to him, they've decided to do a shave removal or could do sirolimus for systemic therapy. And currently at this time, he still has UCD, but they are monitoring for MCD development or progression. And for the discussion, there have been minimal reports of cutaneous disease and Castleman disease. And all of them that have been reported have been in MCD with conditions like dermatitis, cherry hemangiomatosis, hyperpigmentation, or Kaposi sarcoma. To date, there's not been any publication detailing vascular lesions or angioid lesions in patients with UCD specifically. And as previously mentioned, the vascular lesions in MCD are thought to be from increased IL-6 pathways. The pathophysiology of the vascular lesions in UCD has yet to be elucidated at this time. This case, along with the previous case of MCD, demonstrates possible associations between Castleman disease and cutaneous hemangiomas. So we say that a multi-center study may be warranted for further investigation of this possible relationship, and that the identification of an association could aid in the diagnosis of patients and possibly decrease the morbidity of Castleman disease. Thank you.
Perfect. Thanks, Lauren. Just for the audience, what's the diagnostic criteria for Castleman's disease?
It is the involvement of a lymph node, and then on biopsy showing lymphoid hyperplasia. And for multicentric, it would be multiple lymph node regions involved.
Perfect. Thanks, Lauren.
Thank you.